thank you for joining us for the August episode of Stop Diabetes Insight. We are the American Diabetes Association. I'm Beth Grant, Marketing and Communications for the ADA. And with me today, I have a very special guest, Brenda Jagatic. Did I pronounce that correctly?
Yes.
Fantastic. Brenda is with the Indiana State Department of Health, and she's going to talk to us a little bit about diabetes education. But really quickly, I'm going to go through a few of our calendar of events for local events here from the office. If you check out our slide, we have a support group event coming up August 18th. That is held at our office. Our Family Link event is August 22nd. We also have a golf outing that's coming up August 31st. Our Step Out Walk event is September 19th. We are offering an Ask the Experts event September 22nd, and that will take place in Lafayette, Indiana. Then American Diabetes Month is November, and if you stay tuned to our social networking, you will find out a lot more information that will be coming up for the entire month of November. Then our special event in November is our J.K. Lilly Gala. That is November 7th. And all of these events, if you go to our website, which is diabetes.org/Indiana. Scroll down toward the bottom, there's a calendaring event. So you can see these events listed, and then you can also select them and get more information and RSVP for the events. So I encourage you to check us out, and please attend our events. Most of them are free. If you have any other information, though, please feel free to call our office. Ask, any of our employees there can give you more information if you're just looking for specific questions. That number is 317-352-9226. All right, let's get into talking with Brenda here. Brenda, again, is joining us from the Indiana State Department of Health. Thank you for joining us today, Brenda.
Thank you.
Let's go ahead and just jump right in. Tell us a little bit more about yourself and what you do.
Okay, so I'm a nurse and a certified diabetes educator.
Okay.
And my role at the Indiana State Department of Health is Diabetes Education Coordinator for the state. And it's my role to increase the amount of diabetes education in the state with a focus on the underserved. So specifically that would be federally qualified health centers and rural health.
Okay, very good. So tell a little bit more about your role, like when you talk about some of the federal qualified health centers, where are those and what?
Okay, so federally qualified health centers, or we call them FQHCs, they specifically are providing services to the underinsured. So that could be people with no insurance, Medicaid, or Medicare. Okay. And so they provide service despite the ability to pay, and there is a sliding scale.
Very good. So tell us some examples about, give us an example of your work.
Okay, one would be providing group education to federally qualified health centers, as well as increasing resources to rural health clinics.
Very good.
One of the vehicles we're using for that would be telehealth.
Okay, well, I've not heard of telehealth, so tell me a little bit about what telehealth is.
Okay, so what it is there's a certified diabetes educator in one location in the state. She's standing in front of a camera, wearing a microphone, and she's delivering diabetes education to another site where there's a group of people with diabetes, and they're watching her in real time. And what I mean by that is she can ask them questions, they can ask her questions, so it's a live interaction.
That's great.
And
without traveling from
Yes.
one location to another, they can be and have a live conversation.
Yeah, so it's a way to deliver diabetes education to some areas that don't have it, but we don't have to open up a new site, or it just is a cost-effective way to try and help these centers be able to deliver diabetes education.
That's great technology. So can you give any other examples of maybe how technology is helping us work with the medical field?
I think the other way of technology would be that we as a team work with healthcare providers in these underserved areas, and we help them to make sure that their diabetes standard of care is current. But the other thing that we do in terms of technology is we're helping them to transfer over to electronic medical records.
And why is this so important?
Well, the electronic medical records, first and foremost, it is helping the physician to have access to the patient's most current data. For instance, if a patient went and had a lab test done and we see that the lab test shows that diabetes is greatly out of control, it's kind of like a red flag that we need to follow that patient up. So it helps that process. But in terms of how we at the health department, at the State Department of Health, use these EMRs, is we don't really focus on the individual, but rather we're looking at the data from clinics. And in analyzing that data, for instance, we can see, well, how many patients in these clinics have type 2 diabetes? How many people in these clinics is their diabetes well controlled? How many have had a routine eye exam in the past year? So what's nice is in analyzing the data on the basis of a clinic, it helps us to identify areas that need improvement. And then what we do is we work with the clinics to help them identify areas they want to work on, and then we help them in that process.
Very good. Well, that's a great way to do that. So let's talk a little bit more. Tell me any other examples that you can share with the public of.
Another thing that we're doing is we're trying to reach out to physicians and trying to encourage them to refer patients that have diabetes to accredited programs. We know that diabetes is a very scary disease, but the research has shown that diabetes education can help individuals to successfully manage their diabetes and reduce the chances of having complications that happen when the diabetes is uncontrolled over a period of time.
That's fantastic. And that's what, we try to work to educate people, and that's fantastic. Great ways to do that.
And I guess one thing I can add is one of the ways that we do that is we identify physician champions. And so what we have a physician in the area that we have recruited to go to different conferences where physicians are to present on diabetes self-management. And he gives it's the peer-to-peer experience. We're identifying the challenges of day-to-day practice, but then also talking about the importance of diabetes self-management education. And so he provides it in such a way that understanding the challenges of just being a primary care provider, but that the importance of the diabetes education, and so he's a champion for diabetes education. He's passionate about it, so we've had him. He did one conference call for our federally qualified health centers, like a conference call, and then we've also have had him do presentations in the community to family doctor conferences, different conferences where healthcare providers are attending.
That's great.
Yeah.
Good to hear. We like to hear that.
Yeah.
Any other information that you would like to share with our audience today?
What I would like to say is if you have type 2 diabetes and you have not had education, please talk to your family doctor, your healthcare provider about referring you to an accredited program, because it can help you manage the disease, successfully manage the disease, and maximize your health.
That's great. Brenda, we thank you for joining us
today
and appreciate all of your information, and we look forward to working with you in the future.
Thank you so much.
Thank you, and we will be right back.
When Margaret and I decided to sell the old estate here, we had only one choice in signage: Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your next event, or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters, with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
Hello, welcome back to our second segment for today. I have with me Dr. Mary Groot. And Mary, can you please introduce yourself to our audience?
Sure, yes. Well, I'm a clinical health psychologist. I'm an associate professor on faculty at the Indiana University School of Medicine. I also serve as the associate director for the Diabetes Translational Research Center. And in that center, we do work to bring interventions that work to support people with diabetes into the community. And so my particular area of interest is diabetes and depression, and I do that research as well.
Okay, well, we're going to get into that topic in just a little while.
Great.
But let's start out. You have a program called Program Active.
I do.
So tell our audience what this is and how they can get involved.
Sure. So Program Active is a research study that we're conducting. We are currently recruiting people into the research study, and the purpose of this study is to evaluate the effectiveness of a combination approach to treating depression for adults with type 2 diabetes. People can find out more about the study by calling my project coordinator, Barb Myers, and we have the number there on the screen for you. It's easy to remember, 1-855-DM-ACTIVE.
That is easy.
ACTIV. And we're very excited to be asking people to join this study. We're looking for adults age 18 or over who have been diagnosed with type 2 diabetes by their physician.
They can see the eligibility requirements on the screen.
And we're looking for people who are feeling depressed. And the purpose of this study is to see if a combination of counseling, individual counseling with one of our participating counselors, plus a combination with community-based physical fitness will make a better improvement in depression and diabetes outcomes than either alone.
Okay.
And we're comparing that to people who are randomly assigned to usual care as well. So we're very excited to enroll. We have the last 30 people to enroll in our study, and so we welcome people to
How many
contact
people
us.
total, did you say? Or
Across 3 states. So this is a study that we're hosting here in Indiana, but we're doing it in combination with people at the University of West Virginia and at Ohio University in Appalachian, Ohio. Total of 150 people in all will be enrolled.
And so you're looking for 30 more.
30
So
more.
if someone out there is interested, they can contact you
Please
at the number
call our
that's
number.
listed on the screen.
Yes.
Okay, very good. So do you have to travel to all these locations?
So we've
You're a
been-
busy person.
Well, we've set up the study so that we are working with the YMCA locations in Greater Indianapolis, as well as a physical fitness program called Parks, which is a partnership with the Indianapolis Public School System.
Okay.
So we've designed this so that it's easy for people to access, because we know that fitness is hard enough, and we want to decrease as many barriers as possible so that people can really participate. We're also very pleased to be working with Eskenazi Mental Health to provide the counseling. And all of the interventions, the fitness and the counseling, are provided for free, courtesy of the study.
Okay, very good. That's so interesting. Well, let's talk now about diabetes and depression.
Sure.
Your specialty area.
Yes.
And so give us some facts, and what does our audience need to know about the topic?
Right. So one of the things we know is that we're in the midst of a diabetes epidemic. More than 29 million people in the U.S. have been diagnosed with either type 1 or type 2 diabetes. And that comes with considerable cost. In 2012 alone, for example, more than $245 billion were spent on diabetes, or the effects of diabetes on the workplace, on community, on families. And with diabetes comes depression. So 1 in 4 people with diabetes will experience depressive symptoms at some point in their lifetime. That's a higher rate than we see in the general population, but comparable to other chronic illnesses. So we know that diabetes is hard enough, and when we add depression on top of that, it makes it that much more difficult. We also know that we used to think that diabetes came first and depression followed because diabetes is a demanding disease.
Right.
But what we've been learning is that, in fact, that's actually a bidirectional relationship, that depression can come first, and that sets the stage and increases the risk to the tune of about 37% increased risk for developing type 2 diabetes later in life, as well as diabetes coming first and depression following.
So
they're both
if the depression is coming first, is that because maybe that person doesn't feel like being active and they just don't really care about what they're eating and they're just,
There's a multitude of factors that
Okay.
set the stage for depression. Family history, genetic risk factors certainly set the stage. We're also learning that there may be biological components that are common to both depression and diabetes that set the
okay.
stage. And we have some very exciting biological research or bench science research happening at Indiana University and other places all around the country and around the world to get a better understanding of why diabetes and depression may go hand in hand.
Very interesting. Well, what is, if someone is feeling depressed, what should they do?
Yeah. So the good news about depression and diabetes is that it can be treated. So people don't, if you're feeling depressed, you don't have to continue to feel that way. We have effective tools. And that's part of the reason why I love doing this work, because we have tools that work. We have a variety of tools that work as well. So antidepressant medications are certainly, there's a wide array of those now. We have more antidepressant medications available for people than we've had at any other time in history. And they can be used individually or in combination, and those are always prescribed by your primary care provider or other kinds of providers in your care. Counseling is also an effective tool, and we know that exercise in the general population is an effective tool in treating depression. And so what Program Active's role is as a study is to evaluate the combination of counseling and activity, as I mentioned. So we have multiple tools, and so if people are feeling consistently depressed or down most of the day, nearly every day, if they're feeling consistently as though they've lost interest in things they've normally enjoyed, and that's combined with symptoms like changes in sleep patterns, changes in appetite, changes in concentration, difficulties with memory, decreased energy, excessive feelings of guilt or worthlessness, or even thoughts of death. Those are all symptoms that, if they're lasting for at least 2 weeks or potentially much longer, that's something that providers need to know about, and that patients need to know that they don't have to feel that way. We've got good tools.
And remove the stigma and don't be afraid to tell someone.
It's very important, actually, for if you're feeling this way, to share that with your provider, in part because there are tools that will help you, and you can have that conversation with your provider. It's also important because we've learned that depression has an impact on diabetes outcomes. So depression is associated with higher blood sugar levels overall. It's associated with poorer adherence to self-care. We know that diabetes self-care is hard enough. When we add depression on top of that, it gets that much more difficult. And we know that there are ways to treat that. So.
Okay. This is a fascinating topic. It's something that I hear about when I'm out doing educational programs all the time.
Yes.
So we're going to take a brief commercial break, and when we return, we're going to talk more about this topic. Okay.
Great.
Thank you, Mary.
Sure.
When Margaret and I decided to sell the old estate here, we had only one choice in signage: Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Everyone knows it's easy to find first-run movies in the big theaters. But where can you go to watch your favorite classic movies on the big screen for the perfect night out? Why rent a flick when you can rent the entire theater? Call today to reserve our 32-seat theater for your next event or just stop by to see what's showing this weekend. The 14 by 7 foot screen and the high quality digital surround sound system offers all the amenities you would expect from the big theaters with a laid back atmosphere and comfortable seating of your own home. Wofford Theater at 1744 South 10th Street in Noblesville gives you the classic movies you want with a big theater experience.
Welcome back, and we're going to now tackle the topic of diabetes and stress. So the emotional stress of caring for diabetes. Let's go into that a little bit.
Sure. So we've been learning that what we used to call depressive symptoms actually can represent a myriad of different kinds of experiences that vary from person to person and even within a person's own experience. And so one of the phenomena that we've really now have a better understanding of is this concept called diabetes distress. And that term was coined by Dr. William Polanski, who founded the Behavioral Diabetes Institute in San Diego. He's a clinical psychologist and has spent 30 years listening to patients with type 1 and type 2 diabetes. And so what we mean by diabetes distress, or diabetes burnout is the other term that you may be familiar with, is the idea that there is emotional stress associated with caring for ourselves 24/7, 365. And when we think about it, there's really no other way that we're required to care for ourselves with the kind of intensity that we ask people with diabetes to care for themselves.
Right.
So, and that is demanding. It's emotionally demanding, it's behaviorally demanding, it's demanding in terms of time. So when people are encountering diabetes-related distress, they may be struggling with self-care, being able to fit it into life. That can be particularly augmented during stressful times of life. Mm-hmm. They can be struggling with the healthcare team, maybe not feeling well understood by their healthcare team. There may be limited financial resources, limited sources of social support, feelings of failure or disappointment, and many patients are feeling a sense of shame that they may not feel comfortable sharing with their providers, and so they're carrying this burden of shame or a sense of failure, much more negative appraisal of themselves than may be warranted or may be shared with others, and so it becomes an invisible burden.
What are some signs and symptoms?
Yeah, so many of the things that I just mentioned are signs and symptoms, but there are two primary signs and symptoms. One is certainly for providers to be aware of and also for patients to be aware of, is if people are really struggling with their A1C value, mm-hmm. they have a target goal that may not be the ideal target goal,
right.
but that may be their target goal, and they're unable to reach that can be a part of and a sign of diabetes distress.
And that's common. I hear that frequently from people with type 1 or type 2 diabetes. They're so focused on that A1C, and when they miss it by just a tenth of a point or something, they're frustrated with themselves.
Yes. And the other major symptom of diabetes distress is a disconnect between a person's expectations for themselves and what they're actually able to do. And anytime we set expectations that are not realistic for our situation, mm-hmm. That will contribute to, that is the definition of stress, is our inability to match the demands of the situation of the time. And all of that can lead then to a persistent pattern of lack of self-care, which is what we call diabetes burnout.
Okay. So if I'm feeling burned out, mm-hmm. Will I get over it? I mean, is it something that I'm going to just live with forever, or will I feel in control?
Good news about that. So we have a tendency in diabetes land, I think about that as the psychosocial environment of diabetes, to think of that we're either completely in control, and much of our language suggests this too, by the way. We're either completely in control or we're burned out, and that either of those may be permanent states. But in fact, what we have been learning, certainly from patient experience, and we're just starting to learn this now in the research, is that people's experience with diabetes self-care will undulate over their lifetime. So some people may have a period of a few months or maybe even a few years after they're newly diagnosed where they're spending a tremendous amount of energy and time to support their diabetes self-care and succeeding. But that may be a little unrealistic and not sustainable over time. And so then people can undulate and have peaks and valleys in their self-care. The goal is to really understand where you're at and where diabetes is on your priority list at any given time, and then to share that with your provider. So providers need to know when you're struggling, and so many patients will carry that burden silently. But actually, it's better to share that with your provider and also to seek out diabetes education. So we've learned that diabetes education is an effective tool in treating diabetes burnout, in part because it gives people new sources of information that they may not have heard when they were first diagnosed. It also provides support. And we know that it takes a village to support diabetes. And that's diabetes education, that's providers, that may be family members, that may be changing up some of the communication in the family, multiple pieces that may go into that.
You know, it warms my heart to hear you talk about this because I've had diabetes, type 2 diabetes now for about 17 years. And I have been there myself. I work for the American Diabetes Association, and people are like, well, how would you go through that? Well, I didn't always work for the American Diabetes Association when I had this, but, you know, I still find myself sometimes, you know, kind of up and down a little bit because it does get difficult. And it's nice for people to understand that they're not alone and that they're in a group of people who all feel the same kind of thing. And so therefore, don't be afraid to say something to your provider or to a friend or to a family member, someone.
Yes.
Because you can get help and you can work through it.
Yes, exactly.
That's good news.
Yes.
So, what tips for providers, if we have some providers watching out there,
Yes.
what are some things that they could ask their patients, or what are some signs that they need to look for? Because you know, doctor's visits are so quick these days.
They are, and providers, in fairness to providers, they're under a tremendous amount of
Extremely,
pressures
right.
and demands. But that's, of course, not a reason not to provide good care to patients. And so it really is a partnership between patients and providers. So what patients can do is share how they're feeling. That may not be the long version, that may not be the hour-long version, it may be an abbreviated version, but sharing changes in mood, changes in self-care, feelings of struggle, and using that word struggle is certainly a good tip-off to providers. When I talk with providers, I also urge them to ask these same questions, to ask, how are you feeling? How are you feeling emotionally? Has there been a change? I see that your A1C is not at the target. How can I be helpful to you, Mrs. Jones, to support you in your self-care? So when patients come with that information to their appointment of asking for specific kinds of support, or even just saying, I'm stuck.
Right.
And providers then are listening for that and hopefully also asking for it. That's when we can bridge the gap and provide the support that people need.
Understanding that our providers are very busy, make a list of things that you want to talk about when you go to your doctor's appointment.
Great idea.
And then you've got it there and you won't
Yes.
forget things once you get there.
Exactly.
Yeah.
It's also helpful if you're someone who has a hard time remembering what takes place in the doctor's office just because there's so much
Right.
information. Bring a notepad or bring a note taker.
Exactly.
It can be helpful if you have a helpful family member who needs a job to help with diabetes that's truly helpful to you, and you need someone to keep notes, have them do that.
Well, this is a topic we could spend much more time on, but we're out of time today.
That's quite all right.
So thank you very much for this introduction to diabetes distress, diabetes and depression and burnout, and giving our audience some resources and some ideas for coping with this. And as always, you can contact us in our office. Our contact information will be on the screen. You can follow us on social media. Call our office at 317-352-9226. Or you can send an email to our office. So I think that's it for today. Thank you again for being here. We thank Brenda Jagatic from the Indiana State Department of Health for being here for our first segment. And everyone have a great day, and we'll see you in September.